It's incredibly hard to encompass all that's in medicine, and even understanding of the teeth being so interlocked that every single tooth is related to an organ, that these pockets could have infections that you won't see unless you do a cone 3D imaging of it. These are still things that are somewhat novel in the medical
Yes,
field, and you got to be outside of the norm to pick up
right,
on this. You have to be a sort of pioneer and fringe person in medicine to be able to understand what you're even speaking about right now.
right,
but
exactly.
but at the same time, I completely understand that at a certain point you have to take things into your own hands. And as a patient, if you're not getting the answers and you're in a dire situation, which many patients are, and you especially were, you have to start doing some sort of research and some sort of basically understanding of what's going on inside of me.
Right.
And so you did that, and it took so many years. But take us now, you're having this operation or this procedure to remove all of these infected areas, to clean these infected areas out. Did you go into it thinking, this is it, I'm going to be better? Or was there still some trepidation of, well, let's see how this goes, but I don't know, I've been doing this for how many years now? Is this really going to suddenly solve everything? What was it like going into that procedure?
Um, how do I describe this? I mean, there was a piece of me inside that was very calm,
Mm-hmm.
but it was very challenging for me to leave my house to go to a doctor's appointment, let alone 3 states away. That was also that. I mean, the challenge of that was overwhelming. The all of the toxins, some of the toxins from the root canal teeth and the cavitations are neurotoxins, and so I was having it. I would get really shaky, and of course I had lost 73 pounds. I had eaten properly for 2 years, so I was in bad shape, and it was hard to cope with with traveling. That
Sure.
was very, very challenging. My sister flew in from out of state and drove me and my mother down to Texas. We went through, it's kind of crazy. We went through historic flooding, and I'm just watching out the window of my car uh, as we travel along. All these things kept happening. And I just kind of felt like I was in this eye of the tornado. I'm watching all this around me, and I'm thinking, okay, well, and I just decided that I would tell myself every hand that I come in contact with is a healing hand, and I just kind of visualized everything being successful. You know, visualization is a great tool. Athletes use it. It tends to help direct things. They don't exactly know how it does it, but I tried to use those tools and meditation as I went on my travels there. And your question about the other part of that question to answer it is, was I certain that I was going to be better? No, I wasn't. But I really felt that I wasn't going to live if I didn't have it done. I knew from the research I'd done that 100 out of 100 root canal teeth contain infection. The tooth has hundreds of miles, one tooth has hundreds of miles of microscopic tubules
Mm-hmm.
that are just a hotel for bacteria when you turn them into a root canal tooth. They just set up and have a party in there and cause havoc. So I knew that I needed to get rid of that infection if I was going to survive. What I wasn't sure of was, could I survive having that much surgery? And I didn't tell my my dentist that I had heart palpitations and an elevated heart rate. This is not something I recommend people do, but I was afraid that I mentioned that to them, they wouldn't do the surgery.
Yeah.
So again, you know, having to make difficult choices in a way that's potentially not even fair to your doctor, but you don't want to be denied treatment. Um, and I had great results, you know, when they did the surgery. As soon as the surgery was over, I I was laying there in the hotel room and I went, oh my gosh, my heart rate is really slow. Being a nurse, I started checking and my heart rate was in the 60s and my heart rate had been in the hundreds for 2 years. And I didn't have any heart palpitations. And I'd had them heart palpitations, especially when I was stressed, once a day for a year. And I've never had any since. And that went away right after the surgery.
Yeah,
Right.
that's incredible that it happened so quickly, but at the same time, you're removing something that was a constant stress to your immune
Yes.
system, to your body, to your nervous system. It was an active infection, just thriving, and 9 of these, imagine,
Yes.
spots with just these different microbes that they're just causing so much inflammation and pain to that area, and that was the cause of it. And you were able to address that cause.